Hi, I'm Haley Boyko, and I'm here with my professional interview.
Hi, I'm Jill Coomber. I'm an occupational therapist of 20 plus years.
All right. So first off, I'm going to hand you my resume, and you tell me what you think about it, please, and any words of wisdom you have for me.
Well, it looks very professional, and I think the kinesiology is a wonderful asset to moving into the occupational therapy profession. That's going to give you an advantage, definitely. And your volunteer experience is good, and of course, getting into an occupational therapy program, they'll require you to do volunteer hours in several different settings.
Right.
And that's a wonderful thing to do. You will benefit from seeing what you like about the profession and areas that you certainly don't want to have in your profession. I, for one, love geriatrics and couldn't wait to get out of my pediatric volunteer. So,
all right. Thank you.
uh-huh.
And then going along with that, what qualities do you look for when you hire a person in the career field of occupational therapy?
I look for, one, I look at their references closely, see what experience they have, look at the length of time that they've been in previous positions. So that sometimes is an indicator if they're hopping around from job to job that maybe there's some problems with interpersonal skills. It's very much a team philosophy. When I was a director of rehab, I wanted my team to be happy. A happy team makes happy patients, and strong leadership provides a happy environment for therapists to flourish. But I would ask you what your expectations are of the job. I always felt that whatever was important to my therapist was important to me, and that's how I guided my directorship. But yeah, it was
Right. Awesome. Okay. How does your personal philosophy affect your professional practice?
okay. My personal philosophy is ethics, strong ethics. In the rehabilitation world, at times, it's a tough place to be because you want to provide what's medically necessary to a patient, and yet sometimes the insurance and what they're able to get is a conflict.
Right.
And so I always erred on the side of providing what was medically necessary. Medicine is a business. We go into medicine because we want to help people and we enjoy that. But it is a business, and we are reminded of that. And you just have to make sure that you're always putting the patient first.
Right. Good. All right. So this is a question I'm really interested in. What are the day-to-day responsibilities of an occupational therapist?
Well, that I can go into great length about. It depends on what setting you're in. If you're working with pediatrics, you may be in a hospital. You may be in a rehab setting. You may be in an outpatient setting with pediatrics. The same with geriatrics or adults. We have acute rehab, which is a setting where people who've had a stroke or a total hip replacement or a back surgery will go into an acute setting where they have to undergo 3 hours of therapy a day. So they have to have the tolerance to do that.
Right.
And that's usually a short length of stay, about 13 days. In the hospital setting, you may only see a patient a couple days, and then boom, they've been moved on, maybe back home or to a skilled nursing facility where they are allowed to stay there up to 90 days for their rehab recovery. That setting, the whole premise is to get them back to their prior level of function. So let's say if they've had a hip replacement surgery, you're going to teach them modified ways of performing day-to-day what we call activities of daily living.
Right.
So you want to be able to get them back home and do it safely so that their surgery is successful. I work now currently in the home health setting, and home health, the emphasis is to keep the patient in the home.
Right.
Because they're very high risk for going back to the hospital, being readmitted. And you do a lot of training with caregivers, family members, so that they can help the patient stay in the home safely. So you're doing a lot of teaching. By the time I would say occupational therapists are teachers, essentially. They're teaching people new ways of independence.
Awesome. All right, should we take a break? Okay, so continuing on, are you involved in any professional organizations in the field of occupational therapy?
Yes, I am. I'm neurodevelopmental treatment certified, and that is a long word for emphasis on neurological problems that patients have, strokes, Parkinson's, things like that. So I've done a lot of advanced training for rehab. Stroke is kind of my specialty. I enjoy working with stroke patients and watching the recovery that they have. It's catastrophic often when it occurs, and they have lost so much function, one side of the body or the other, and to be able to work with them is wonderful.
Awesome. Okay, which aspects of your education and training have been most helpful for achieving success as an occupational therapist?
Oh my goodness, that's a good question. I would say my neuro training has been the best thing. I can apply the skill set to other people. It doesn't have to necessarily be a neuro patient. I can apply it to a back patient. I lost my train of thought. This is where you get to laugh, Professor.
We'll just keep it in.
Yeah.
Professor.
Yes, so I would say that my advanced training has been spectacular. I was trained at Loma Linda University, and their program is great. Very hard, very difficult, but great. High percentage that passed their boards the first time. Pretty much they said to me, whatever your GPA is, you'll pass your boards within 3 percentage points.
Oh, wow.
And I did.
Nice.
So it was good.
Yeah, and that's good because I'm looking into Loma Linda for my
Oh,
grad
great.
school.
If you need a recommendation, you let me know.
Oh, awesome. That's good. I'll let you know. Okay, and then to finish off, what advice would you give to an undergraduate student who is interested in pursuing your career?
Oh, I would say you have chosen a great career. It is recession-proof. Our population, if you chose to go into geriatrics, that population is growing exponentially. I have seen more patients that are 100 years old in the last 2 years than I ever have in my career. So it tells you that medicine is keeping people alive longer. Right. And with that, you need a lot more therapy. Because the body's aging, and we're trying to keep people in their homes, out of institutions, where their quality of life is the best. Yeah. I would tell you to do your volunteer hours and figure out what you really like. Try and do different settings. I did a non-traditional setting in an Alzheimer's dementia unit, and it was significantly useful in my career. We have a lot of dementia now, right? And I learned an awful lot of what I could do to help patients and what I couldn't do to help patients. That's kind of the advice I would give you. I think those volunteer hours in the different settings are critical because it gives you an idea, a focus when you're in school. Hey, I particularly like this. I'm very interested in this. And you can pursue it. Right. Yeah. But you won't have any trouble finding a job. Yeah, exactly. We are a dinosaur. We are, and I have job offers all the time. And I have the ability, the autonomy to choose how many patients I see a day, and that's a beautiful part of the career. Yeah. Yeah, to be needed and wanted. Yeah.
Awesome. Well,
Yeah.
thank you for that advice. I'm gonna remember that.
Yeah.
Okay, so this is the end of the interview. Thank you so much for interviewing me.
It was my